Sounds good.
Okay, awesome. So this is going to be the Virginia 100 state deep dives. I don't think that you were on any of the other calls that we did for like the overview and the process. So I'm going to share my screen and then I will kind of walk you through like what the process looked like, how I got to where we are with this data, and why the counties that ended up on this list because it wasn't oh, it would be really nice if we could move these people out. It was a data driven process, which I love that, because sometimes when you live in a place or you're familiar with a place, you get blinders on because you know it so well, you just assume certain things. But we decided we wanted to let the data take us to where we wanted to go. So let me share my screen. There it is. Awesome. And I'm going to move this out of my way. Okay, so here was the process that we went through. Okay, so this is the focus for this was power building. Where can we have power? When we did the exit interview project for 2022, one of the things that kept coming up in conversations was, how do we build power in these places? Because we're putting all this effort in, but how do we actually make moves that are powerful and help us kind of move along? Just because a county didn't make this list doesn't mean that it's not worth an organizing effort. And what I'm going to show you is the counties that made the list, and then I'm going to show you the other counties in Virginia that did not make the list. So I'm going to be kind of showing you what I call the clean and the dirty data, so you can kind of see how it all goes together. And it's a very short-term piece of a much longer-term strategy, especially because, like I said, I'm in Bristol, which is Northeast Tennessee and Southwest Virginia. Southwest Virginia used to be totally blue in 2008, and now it is totally red, right? But that means that if we got that way, we can get back to where we were. So we're going to do Virginia. Those were the other states that made the list. But this is how I started with the data. I literally went through independently the presidential results for 17 states for 2020. And then whatever their House and Senate races were in 2020 or 2022, 2023, as you know, Virginia, you guys have an election coming next week. And you've been kind of all over the place, kind of tracking where your races are and where they come from and all that good stuff. But so when I went through these, it was looking at which counties kept showing up that had, 10% or less in terms of their margin consistently in each of these races. And so once I identified, think about like a funnel, once I identified our frequent flyers, our frequent guests that kept coming up, then it was time to kind of say, okay, we're going to go with these. And then when we got to the House races, it was to look if there was any commonality in those houses where we could build power. So like one of the best examples of that is in Colorado. So there were 10 states in Colorado that made that list. Well, when we got to the list and I looked up their districts, because I don't live in Colorado, so I don't know, right? When I got there and looked at the districts, 7 of them out of the 10 were in District 3, which is Bobart's district, right? So I love that that's where the data led, and it's a place where we can build significant power. So we'll look at voter registration, turnout results, population, and percentages of rural people. So that's what I meant when I said think of it like a funnel. So the important thing for me was to go where the data took us and not where we wanted to go. But it ended up taking us to battleground states, key races, swing states, those types of things. So districts 2 and 7 are both considered key races in 2024, and our list includes counties that are in both of those districts. One of the best unexpected finds was 3 counties that are in District 1. And, I talked to a friend of mine, Roberta Thacker Oliver. We're Facebook friends, and she was like, District 1 would be hard to flip. And I said, yeah, I get that. We're just focused on the surprise that came up there and how that could be impactful, because we're looking sometimes at registered voters who didn't vote. And if those voters voted, it would cover 77.3% of the vote difference to flip that seat. So imagine if you could get the people who are already registered, apparently they're interested in voting, to go vote. That would cover, 3/4 of what we need to flip that seat. So that's kind of where we got here. And on the gubernatorial side, the non-voting registered voters in these specific counties accounted for 40% of the margin, right? So it's pretty impactful where the data takes you. So when you look at the presidential data, this is the presentation that you're going to get. So you're going to see Caroline, Essex, Goochland, James City, Lancaster, Lynchburg, Nelson. Northampton, Surrey, Sussex, and Westmoreland. I'm now going to stop sharing because this looks all pretty and clean, but I want to show you what the dirty data looks like and how we got here. So let me stop real quick. And then I'm going to share with you. And feel free to chime in and ask questions as we kind of go through the process. Here's my talk. This is what I get. Go ahead.
How did you determine if like the counties were considered rural? Did they have to be like have 40% or 50% rural turf, or like how?
They didn't have to be. So we used the 2010 census data, and we looked at, once we found the counties, we looked at the percentage rural that they are. And I'm going to show you that on the spreadsheet as well, so that you can see them. And there it is. Okay, got it. So I'm going to go down here to Virginia. And then let me get back to Zoom and share. So that's because that's a common question. So what, and I struggled with this most in Florida because that's not a place that you normally think of as rural. And so sometimes there are counties that aren't, you don't think of them as rural, but there's enough of a there's enough rural population that it's worth organizing them in those counties. And then vice versa, it's, you know, largely rural counties where you have, you know, that impact. So when I went through these, first it was starting with these margins, right? 10% or 5%, and just identifying what those look like in each of these races. So literally looking up individual races and finding all the ones, and then narrowing it down till we got to this group. And then looking at their houses and a percent rule. So this is what you were just asking me about. So in all of these states, except for 2, they are almost 80% or above in terms of rural, right? So you've got James City that's 15.9%, Lynchburg that's 2.7%, but everybody else is at that almost 80% or above. And then we put state population rank and the population of these counties as well. So when I go down and I look at who's voting and who's not voting in each of these races, it gets really interesting because the counties that had less than 5% voting, 6 of them voted for in the presidential election, 4 voted in the gubernatorial election, and 7 voted in the Senate, right? And it's interesting to see, because when we think about GOTV, a lot of times people think of it as 2 things, right? All into one. They think register people to vote and get them out. But sometimes that's not really what you need to do. And it depends on the state. Some states you're automatically registered to vote when you go to the DMV. Some states you're not. So it's finding out, did people voluntarily sign themselves up to vote? And are they simply not turning out? Is it automatic and they're not turning out because they never cared about it to begin with? But knowing that, what it does is help you figure out where you're going to put your money. Do I need to spend money in voter registration, or is what I really need to do spend money in turning out the vote? Like Tennessee is definitely a non-voting state, right? And, you know, it's represented by the people that we have serving in our state legislature and in Congress. But so this is the voting data. And this was registered in 2023, the spring. That's when I did all of this data. So the populations are there, the people that are registered to vote, and what percentage that is of the population. So 65% or more of each of these counties are registered to vote. But what percent of that population is actually turning out to vote? And in the presidential election, it never got above 68%, which is crazy. We should be having 80% in terms of people turning out to vote. Sussex at 46% and Lynchburg at 44% is like a little frightening. Now, Lynchburg, I don't know whether you take into account, you know, the schools and things like that, and maybe some people aren't local, but if only half of the people, we usually think about the lower voter turnout coming off in the off years, right? But if you're talking about major presidential elections and people still aren't turning out to vote, then that gets really scary. It says for some reason they're not engaged. Do they have what I call politic fatigue? Because there is, I think that we're dangerously close to that. And that's just my personal opinion, because everywhere you look, when it comes to social media, you know, mainstream media, it's the same stuff over and over, barraging people. And some people are just getting tired. And so we've got to figure out how to get those folks re-engaged and reinvigorated in this process. And in 2020, a lot of that was people voting just because they didn't want Trump in, right? Well, that may or may not be the case in 2024. And even if it is, we need to have voters voting regardless of who the candidate is, but voting for what we want things to look like. What are the initiatives that we want people to benefit from? And so that's what this data will help us do, is figuring out, okay, so what percentage of the population that's registered to vote is actually voting and who's not. And then I got down into, so you'll see my color-coded information. So what I did, this column over here, when I looked at the other votes, sometimes the numbers in the other category would have been enough to flip that county. So that's true in the case of Essex, right? It was 3,038 votes that were Democratic, 3,075 Republican, and 65 were other. So think back to 2020. And there were 65 people in this county that could not, for whatever reason, get themselves to vote one way or the other, knowing what was on the line. And if they had, and they could have gotten themselves to the Biden side of things, to the Democratic side of things, it would have flipped that state. So it's interesting to see things like that, where like this one gets you within 240 votes, right? This one will get you into 308 votes. And these, when you see it go negative, that means it's way more than enough. If you get the others and you see it go negative, that means you've got more than enough to have closed the gap. And so that makes it very, very interesting. I would love to hear your thoughts about, those voters that are voting other, and how we get them engaged and what you think the information means and how you could use it. And hi, Sandy, I saw you come in. So Sandy, what I'm showing you now is the raw data as I processed it and went through the process. And then I'm going to go back and show you the PDF, which is the clean version that I'm sending out to everybody along with this recording. So I did the same thing in the Senate races, and then the same thing when it came to the House races. And then it was about identifying the districts. Where we ended up in Virginia was right here. So in Virginia, when you look at these counties, this was the presidential results, right? 54% Democratic, 44% Republican. It was a 10.10% difference. And the difference in the votes was 451,138. Not a big impact from these counties on that, right? 5% of the presidential race. That's not where we're really focused. What we are looking at are these two things. House 1 results, which I think is super impactful, and the gubernatorial race. So in the gubernatorial race, it was 48% Dem, almost 49, right? And almost 51% Republican in terms of the vote. 2% vote difference, 63,688 votes. In just these counties, we had 25,935 registered voters that did not vote. And had they voted, it would be enough to cover almost 41% of the vote difference in the gubernatorial election. Think about that as what we have facing us in Virginia in this year's election. It makes up almost half. And a lot of this is about framing. People think that in rural places, they're just lost and they're red. Rural does not equal Republican in many cases. And it's about finding ways to give progressive voters in these counties permission to vote the way they would like to. And let themselves be known, and then have the impact that they want to have on that state and on the legislature and what's going to happen. And there's a lot on the line with Virginia. I personally volunteer at a women's health clinic over on Osborne Street here in Bristol, Virginia. When Roe went away, that clinic, the person who owns that clinic, used to be open on the Tennessee side. And after Roe went away, it was immediately, nope, you had 30 days. And so they had to close it down and then open up a brand new clinic half a mile away on the Virginia side of town. And, we are seeing people come from Alabama, from Georgia, from South Carolina, from Florida, even from Mississippi, even. And what happens if Virginia ends up going to a much stricter ban than it currently has? And what does that do for access? And not only that, in many rural places, what I'm trying to share with people, so like on last week's networking call, we do that the last Thursday of every month. We were covering healthcare from the position of three main things. One was abortion / abortion bans and reproductive health. And then the second was Medicaid expansion. And then the third was rural hospital closures. And the framing for me is a lot of people that I see that are anti-abortion are folks that are, it's because of their faith or because of their values, the morality. And what I'm sharing with people in rural places, especially like where I am here, is that your morality is actually hurting the people you love, because we already have higher rates of maternal vulnerability. We already have higher rates of maternal deserts here. We have high opioid rates. So what does that give us? It gives us counties that have 4 and 5 times the state and national average of drug exposed babies, NAS babies. Because we're the opioid area. So when you think about all of those things, what does that result in? It means we already have in rural places a hard time recruiting physicians, especially in specialties. That's already a hurdle that we have to jump. When you add the bans and the restrictions, we're losing providers that we do have. We are having less people wanting to come in these places because some of the procedures necessary that they would be required to perform, they could be, prosecuted for, or, all of those different types of things. And so it's being able to communicate it. I'm not trying to convince people that abortion is okay or right. We're talking about what's best for everyone. So abortion bans are actually bad for people that want to have babies in rural communities, because you're not going to have OBGYNs. You're not going to have high risk specialty OBs coming into the region, which we need them. So these are some of the types of things that is the way that I'm framing on our networking calls about how we can talk about things in these rural spaces. So, and healthcare is like my jam. So I went on a little bit of a tangent. I apologize. But then going to District 1. In 2021, it was a 13% difference in that race, 44,599 vote difference. 34,486 registered voters didn't vote. That's 77%. So in District 1, the important thing is, how do I get people re-engaged? Why aren't they voting? And I don't know that people ask that question when we're out canvassing and when we're, phone banking and texting and, or having conversations at the grocery store. I don't know that people are saying, well, okay, so why aren't you voting? Because there's got to be a reason. And if we can find that reason, then we can get those people re-engaged and interested in the process. So I'm going to go back over here, and then I'm going to open it up for just like some questions, comments, any of those things. So going down, and this is what I was talking about in the House votes. When you look at District 1, there were 3, James City, Lancaster, and Westmoreland. But then I wanted to see what's happening in terms of registered voters from 2022 to 2023. What was the loss and what was the gain of voters, and what percentage did we increase by? And so Virginia is one of the places that has actually had an increase in their voter registration. Iowa, on the other hand, not going in the definite, negative direction. So I wanted to look at that to see if that's contributing to the results that we're getting in terms of the elections and the positions. These are also ones that we identified as like close, can flip, as individual counties. So I'm going to take a pause right there, put a pin in it, and then open it up for feedback or questions around the data, the process, the counties, any of that good stuff.
Do you have a sense of where these counties are in Virginia? I'll like pull up a map later to look, but from off the top of your head, like, is this in the Southwest, the Southeast?
It's not Southwest.
Central?
Yeah, it's
Okay.
not Southwest. I would love for it to be. Now, I will tell you this, because I live here. I did the numbers for Southwest Virginia, because I would love to see. So it's weird. There's a relationship in Southwest Virginia and Northeast Tennessee that they impact each other a lot. So like all of Southwest Virginia is dependent upon our hospital system that's actually based out of Tennessee. They were created under a COPA. I'm not sure if you know what a COPA is. A lot of people don't, but some people do. But they basically created a legal medical monopoly here. So geographically, this region between the two states is about the size of New Jersey. And we have one healthcare system that controls about 98% of all inpatient care. They control a large percentage of the nursing home care, pharmacy stuff. It's crazy. And so Southwest Virginia, they closed one of their hospitals already. They stopped labor and delivery at another one. So Southwest Virginia does not have a NICU. They don't have a trauma center of any kind. And they are dependent upon what we have because Roanoke is too far away. So the majority of these counties are going to be middle to north, but not northern Virginia. So think central Virginia area is where the majority of these counties are. And they kind of inch up a little bit, but that's where the majority of them in. We don't get to Southwest with this list, although I wish we did. Yeah.
That's helpful. Yeah, that's so strange that like that area is, I mean, I know the Virginia strategy and they do not focus on these counties at all, right?
Yeah. And I wish they would. So like on the Virginia side of town, it's country and it's rural. We have ambulances here that they're traveling on 1-lane country roads in the holler. There are places where they don't have signal. And primarily we have a family over on the Southwest Virginia side, the Kilgores, who run much of that area. Like they control it. That's how we got the COPA over there, was with Terry Kilgore. On our side of town, on our side of the state, it was Senator Rusty Crowe, who happens to be a paid contractor for the healthcare system since 2009, right, from Mountain States. And so we had Mountain States and Wellmont, and they became Ballad Health. And literally, it was our state legislatures that created our medical monopoly. So like while we're focusing right now on 2024 from a federal standpoint, on a state level, 100%, we need to be focusing on these areas. Because what I will say to you is that the reason why I feel strongly that movement can happen here is, so very briefly, I mentioned, putting together a healthcare protest here. It happened because my granddaughter was born at our level 1 trauma center at Holston Valley. And once they created that medical monopoly, the first thing they announced they were going to do was close that NICU, which happened to be the closest one to Southwest Virginia. And they were going to downgrade the outstanding level 1 trauma center we had to a level 3. And the nurses reached out to me and they were like, Danny, they're going to close our NICU. And here's the way that I felt. My grandbaby was born weighing a pound and 1 pound, 3 ounces. She spent 91 days with them. And I have a decent social media following. So they felt like if anybody could help, it would be me. And what I thought to myself is, okay, if I give these folks like 3 months of my life and, like bring things to light, because I really thought there's no way that the Department of Health knows this. Yeah, no, they knew. They knew everything. They knew about the CEO. They knew everything. But I thought I owe them that. I didn't know it was going to lead to a protest. I didn't know that we were going to literally be camped outside of a hospital for 257 days, 24 hours a day, 7 days a week, but we did. But here's the thing. I am a person of color in a region that is 97% white. I'm born and raised here, but I left for a while and came back. I'm also pretty progressive. And still, I was able to hold several community forums that had anywhere from 250 to 500 people attend. We got 30,000 local signatures that we took to Congress. Like I met with Marsha Blackburn. I met with Mark Green. We went to Tim Warner's office. We did those things. So do I know that in this region, if someone were to tap into the issues that are really affecting these people and communicate it in a way that they get, can they be organized? Can they be flipped? 100%. 100%. And I think that, but the difference is we've got to make it make sense to them. And so one of my strategies, like at the Women's Health Clinic, is I'll do like a recap and I'll say things I heard while outside defending patients, and I will talk about some of the hateful things that these godly people are saying to patients. And what happens is the people here who don't necessarily agree with abortion are saying, that's horrible. That's not godly. And so I don't have to get them to believe that abortion is right. But if I can cause that little divide there and get them to say, well, you know what, this is not okay, then the enemy of my enemy is my friend. And then that's one foothold. And then if I can make them understand how they're hurting the people that they love, the people that want to have babies, then that's just another notch. I'm not going to argue your faith with you. But if I can show you that the thing that you are voting for because of your morality is actually hurting the people you want and the babies that you want born, then maybe you'll vote differently. Maybe it will shift your frame and you could still honor who you are and what you believe and vote in a way that doesn't cause harm to other people. So I would love to see more organizing in this area. I just don't know when it's going to happen. Right now I'm, you know, but there are people here that it is shifting and it is changing. And little bit by little bit, I have hope. So any other questions or comments about where we are in reviewing the data or anything else, as a matter of fact?
Well, I need to have, I was curious, could I get your email before I hop?
Yeah.
Virginia is one of the states I work on, and I'm from the Eastern Shore of Maryland. I've spent a lot of time on the Eastern Shore of Virginia. So not all of rural Virginia, right? But parts of it. So
Yeah.
I would love to talk more about it later.
Yeah, I'm 100% down for that conversation. And we have I don't coordinate with her. She's just a Facebook friend of mine from the protest days, is Roberta Thacker Oliver. She is Lee County Dem. She runs the 9th district and she's super passionate, fantastic individual. And she has a lot of connections. She's been in the region now for 21 years, I want to say. But I do, you know, I have hope. It sounds so crazy. People will say, I don't know how you have so much hope. And I'm like, well, if we don't have hope, we might as well be dead, right? We might as well just give up, pack it up and go home, because that's the only thing to me. So like when I did the exit interview project, I interviewed about 50 organizers across the entire country. And one of the things that kept coming up was what's missing from the messaging. And everybody kept saying, hope. Hope is missing. And so I've asked this question a lot of times, is when is the last time you saw a progressive candidate that made you feel hopeful? When was it for you guys?
A little bit, you know, I don't know, typical, but you know, I used to live in Queens, so definitely AOC.
Yeah, gotcha. Now, what about on so AOC, yes. For me, presidential candidate, who would you say?
Definitely, I don't have anybody for that, I guess, except for Obama, right? It's been a long
That's
time.
what everybody says. When we talk presidential, everybody says Obama, right? And I think that we have lost a little bit of that. We can actually do this. So, you know, sometimes people will say we can do better. I would love to run a campaign that says we are better. We are better than what we are doing right now. What I believe is that people are so covered up with fear, with ignorance. And I explain to people that there's a difference between ignorance and willful ignorance, right? There's nothing wrong with being ignorant. That just means you don't know something. But willful ignorance is different. That means now you know, and you're simply choosing not to do anything with it and acknowledge it. And there's a difference between those things. But I think that if you paint a picture where people realize it is not a lost cause, and I really don't believe that it is. I do think that we will show up. It might be a little bit of a scrappy road to get there, but I do think that people will show up if we can tap into their belief and hope and humanity. So what I tell people when I do trainings on, you know, how to have conversations with people, like when you want to put a yard sign out, when you want to knock doors, when I do trainings, I'll say, you know, I approach every conversation with two things: respect and compassion. Because if I approach every conversation with respect and compassion, at the end of that conversation, we will have at a minimum understanding, even if we don't have agreement. And understanding is really what we're going for. Because if people properly understand, then they will vote accordingly. And then it doesn't become about party, it becomes about humanity, which I think is the goal at the end of the day. So, but yeah, I put my email in the chat. So would love to connect.
Well, I should hop, but I really appreciate you going through this and I love hearing more about your background. And yeah, we should talk Virginia more.
Absolutely. Yes. Shoot me an email. I'm going to wrap this up and then I will be sending out this email either later today. I have 4 of these today. So give me grace. It might be tomorrow before I get it out.
No worries at all. All right. Thank you so much.
Yeah. Hey, Veronica, I'm glad to see you join in. So we've gone through a little bit of the data. Don't worry about what you've missed because you're going to get an email that has a link to this recording and to the presentation. So I'm going to go back in and just kind of review just a little bit because both of you all missed the beginning. So give me 1 second and I will go back to the actual presentation. Okay, so I'm going to go back to the beginning of this for you guys, just so that you can see this is how we got here. So, oops, I saw a chat come through. Oh, yeah, you're very welcome. So, so this is how I got here. So what I did was actually go through the election data for all of the states. There ended up being 17 of them. And I went through each election from 2020 to 2022. And I started looking at all of the counties that had a 10% or less margin. And then when I started, I would write them down for each of the elections. So imagine notebooks of paper. And then I started to identify the counties that kept showing up repeatedly. And then once I narrowed that down to say, okay, so who had the best margins that kept showing up repeatedly and cross-reference them across the elections, right? Then identifying what are the top repetitive counties. And then what are the population and the percent rural of those counties? And then at the end, looking for common districts and seats. So it's very data driven. And I love where it took us, right? So this is the kind of the overview, right? Districts 2 and 7 are both considered key races in 2024, and they made the list, right? But an unexpected find were 3 counties that are in District 1. And a lot of people are like, District 1 will be hard to flip. Well, guess what? In District 1, in these 3 counties, in District 1, there were 34,486 registered voters who didn't vote in 2022, the House election. Just those voters that are already registered would have been enough to cover 77.3% of the vote difference and flip that seat. That would be surprising to some people because most people think District 1 can't be flipped. But holy geez, just those 3 counties would account for, 3/4 of those voters needed to do that. So that's what this data has brought through. My mom hears me coughing. Thank you. I've getting over a sinus infection and bronchitis, so she just brought me some Russian tea. And the same thing on the gubernatorial side, the non-voting registered voters account for 40% of the margin from the last election. So those are the numbers that really make a difference. And so this is the clean version that you're going to get. So you'll be able to look at the presidential vote, the Democratic votes, the representative votes, and the other votes, the total. And you'll get that for the House races, the gubernatorial race, the Senate race, all of those. You're going to get every single one of them. But what I also want to show you is your population, your percent rural. So all of the counties except for 2 on this list are 75% and above rural counties. All of them except for 2. That's important, right? Because most people think rural equals red. It doesn't. And so we want to show people that so that people can be empowered to go out and organize effectively and productively. Why do I want to show you voting data? So let me go to the dirty version of the data. And I want to show you something that's pretty cool. So I'm going to go back here. All right. So let me go back to Virginia. And this is the percentage of people that are turning out to vote who are registered, right? So 74% of Caroline County are 74% of the people are registered to vote. Got great voter registration. You see that 65 to almost 90% of the population are registered to vote in these counties. But look at the percentage of people turning out to vote. Even in a presidential election, you don't get to 70% of the population voting, which is crazy. And it gets worse when you look at the gubernatorial races, right? You get down to like 30%, 31%. That's insane. So what we know in Virginia, in these counties, it's not an issue of getting people registered because they are registered, right? It's finding out why they aren't voting and being able to mobilize them to get them to vote. So what I believe is that you have to, voting is tied to emotion, whether people think it is or not. If it were just about policy, progressives would win all the time, but it's not. You have to, I believe you have to touch, move, and inspire people in order to get them to vote, in order to get them to do anything, to gain agreement, right? To get their buy-in, you have to be able to do that. And in some of these counties, the people who voted other would have been enough to flip that county blue, right? So you'll see that is the case in Essex County, right? That is the case in Surrey County. That is the case in Sussex County. That is the case. Like, look, these are not like, or what you would need. You would need 650 here. Sorry, I flipped it the wrong way. But that is the case for Essex. You would only need 242 additional votes in Lancaster, right? 300 votes in Nelson. It's doable. And what we're looking are for places where you can move the needle and build power at the same time. And that's how you get to District 3. So I'm going to scroll down here to District 1, the 3 counties in District 1. So that's James City, Lancaster, and Westmoreland, right? Those 3 in District 1 have the potential to really make a difference and build power in that district. And that's an important district. Most people don't think District 1 can be flipped, but it can. And so what we wanted to do was also look at the percentage of people that are registered to vote. Is that number increasing or decreasing? It's increasing in Virginia, which is a good thing. Now, all we need to do is get those people who are registering to vote. And for the people that are voting other. So I said this before and I'll say it again. I want you to think back to 2020 and what we knew was on the line in 2020. And these people could not get themselves to vote for one or the other. What in the world? Like, what in the world? And so we have to find out what that is. Where are we missing these people? And how do we create engagement and get them, to actually take part in the process? So that's pretty much the spiel. I'll go back and everything is included in here. I think I've already showed you that part, but I'll show you again just to, yeah. I think that's what I had up. Yeah. So your population data here is your voting data is here as well. And then this is about figuring out where you want to spend your money. So how can you use this data? I like to wrap up thinking about those things. So you can use this data for strategy. So where do I go? You can use this data for funding pitches. It's not about just saying, okay, well, give us some money to do some work. But if I can go into a place and say, listen, if we organize in these 3 counties, we can, account for 77% of this district's, needed voters. Now that's data. You're telling someone this is something that is worth you investing your money in. So strategy is important. Fundraising is important. And then figuring out where the gaps are in whether it's messaging, whether it's, policy, what is it that's keeping these people from voting? So that's pretty much it. And you guys are going to get a record. You're going to get all of this. So you're going to get the recording of this deep dive, the PDF of the presentation, a link to the Top 100 Counties Project, a link to the 2022 Exit Interview Project. You will get invited. I lead a monthly networking call, and it is the last Thursday of every month. So I'll include a link for you to be able to register for that. And then I've been working on a counties without Democratic Party representation. And hopefully I'll have that completed for Virginia to include it. And if not, you'll get it later. So any questions, comments, anything before we close it out?
Awesome.
Yeah.
Really
So,
awesome.
Share with me kind of what do you think is the most impactful thing about the information?
Being able to see where the vote is increasing in places, and how much better the turnout could be if there was a little bit more structural support.
Yeah.
I'm in Wisconsin, by the way, so this is
So you know, I did
familiar.
Wisconsin's. Did you,
I saw a piece of that, yeah.
okay,
I'm-
awesome.
I was late today.
So I will tell you this. So Wisconsin is one of our target states that we're going to be working with next year. So as long as you're not, because we'll be on the independent expenditure side of things, kind of when we get into by the end of this year. And so we won't be able to kind of collaborate with party folks come then. But what we'll be able to do is we're actually going to be working in Wisconsin. That's one of our target states. So we have Ohio, Montana, Wisconsin, and Arizona. Those are our 4. Now we're still going to be holding networking calls for all the other states where we're not actively running things, but in those states, we're going to be looking for folks who want to help and maybe who aren't fully connected to a coalition or whatever, and they want to get engaged in that process. So I'm excited about that. I love Wisconsin folks, Michigan folks. Those are kind of my peeps. A lot of them are on the networking calls. So
Sure. Makes sense.
Veronica, you got anything, love? I said love. I'm sorry if that's offensive. I am from the South.
Not at all, not at all. Yes, I mean, I think data is so important and so valuable. And we hear register, register, register. But here we have people that are already registered and and so these people are like slightly more motivated than those that aren't registered.
Yeah.
And yet there's still a gap. There's still a voting gap.
100%. And when you get into deep canvassing, so I have this thing that I say to everyone: people don't care how much you know until they know how much you care. They don't care how much you know until they know how much you care. So when I go into communities, I want to be equipped with data that supports them. And so that they understand that I know if they're in a maternal desert, I know if they have high rates of drug addicted babies, I know if they don't have affordable housing, and just different things like that. And then saying, listen, so you're registered to vote. At one point in time, there was something about the democratic process that you were engaged in, and you're not voting anymore. Why? Can you share with me? And so that's a word that I use a lot. Don't tell me. Can I tell you? Will you tell me? That sounds like a little aggressive, right? What I will say to people is, can you share with me what's made you not vote? I mean, I know there could be a myriad of reasons, but I'd really like to hear. Can you share it with me? And then I'll ask permission. Well, may I share with you why I do vote? And I'm getting permission from someone. So it shows a level of respect. And then you're able to have those conversations. So that's this is what I said, every conversation, if you enter it with respect and compassion, you will leave it with understanding, even if you don't leave it with agreement. And at least that's a move in the right direction, right? Is to create understanding. So that's it. That's all I've got for you guys. I will.
I want these sayings on t-shirts and posters.
You want my saying on t-shirts and posters?
Yes.
I do. So they tease me because like Matt, who runs our organization, he's very data and analytical driven, which I am. But so Afton says to me, she says, Danny, she said, you're you take all the data and all the organizing stuff and all the strategy, and you slap a little Brene Brown on it. That's what she says to me all the time. But I truly believe that that's what we need. People need connection. And I don't think that people realize how much we need it after 2020, but we needed it before then. We need it now. And there's something about, I know that it was really impactful for me. So if you haven't seen the documentary 13th, I watched it several years ago, long time ago now. But for me, being biracial and experiencing the world as a Black woman, it was eye-opening and frustrating, maddening, and hurtful to realize that the country that I served in its military, that my mom and my dad served in, my brother served in, that this country intentionally, like with intention, created laws designed to hurt me, to hurt my grandchildren, to hurt, you know what I mean? And that was something that was just like, holy crap. And so I that's one of the reasons why I'm more engaged now than ever, is because, like it or not, it does matter. Politics matters, and it's not politics. I hate that word. It is not politics. It is literally our livelihood. And I think that people have to really kind of understand that. You know, people say, oh, I don't do politics. Well, okay, do you eat? Do your children go to school? Do you drive? Like, all of these things are politics. Yeah, so I totally believe that that's what we have to do, is we have to break it down and stop making it be this DC thing. It's not. It impacts your everyday life. So hopefully this was really helpful and beneficial. I hope that you guys join the monthly networking calls. It's the last Thursday of every month. My face is always there. And it's a great group. And we just have discussion. And usually I'll pick a topic. Like last week, it was healthcare. And I do like a little PDF resource that backs up kind of like everything that I share. And it allows you to kind of go research things for your specific state. And that way we can talk about what's working in some places, what's not working in others. How can we do things better? You know, what's a good way to frame something? And there's a lot of collaborative discussion that happens in that environment, and it's growing. And I love that, because I think that it, you know, in that one meeting, I might have people from 10 to 15 different states. Keep growing that sucker, and you've got the ability to make some progress, to make some change. So that excites me.
Are those meetings recorded?
I just started recording them. So last week's is recorded. We are figuring out our YouTube. So I put our YouTube channel in the chat. We're just starting to grow the Rural Vote. That's the PAC side. So we have to reach 100 people subscribing to that YouTube before I can upload them on the YouTube. So right now it's in my Google Drive before I put it up on the website, but I will give you the link right now. Give me one sec. And I will give you the link to the recording and to the PDF.
And I want you to save your voice.
Yeah, I've got, like I said, 3 more of these today. But it's all good. It really is. I love this work.
I'm gonna try to join you for those. We've got some stuff happening in the house. I'm not sure the timing, but I will try to come.
Awesome. Okay, so let me get back to you guys. This is the link to the recording. Why can't I find Zoom? Oh, there you are. Okay. So this is the link to the recording, and then I'm rebranding the PDF that I did, but I'm going to give you the link to the one that I used. So this is the resource as well. And we focused on three things within healthcare. We focused on abortion / reproductive care. We focused on Medicaid expansion, and then rural hospital closures. And then at the end of that PDF, there's a link to all the places where I got the data and where you can get specific data for your state as well. So it's all in the chat for you.
Thank you.
You're very welcome. All right. So that is all I've got for you. I've got another one of these in 5 minutes. So I'm going to go. I appreciate you all coming, for contributing. Look forward to seeing your faces on the networking calls, and seeing what we can do in 2024 together.
Thanks a bunch. See you
All right.
soon.
See you later. Have a good day.